So we're talking about technology in healthcare. Is it a good thing or is it a bad thing? And we're asking that question because, hey, we can tout technology in healthcare, and there's a lot of good technology in healthcare that can actually help us. We know this. And just think about the life-saving things that we have in healthcare, and thank God for healthcare and medicine in a crisis scenario. So sometimes you hear me talk about medicine, and sometimes you're like, man, does this person hate doctors? The answer to that is no, I do not hate medical doctors. Actually, I have doctors and nurses in my family, and the reality is that we need them. They are smart, they are brilliant, and they are absolutely necessary. So don't hear me wrong. When it comes to general health, though, what happens is we as consumers take our health care, our problems, our symptoms, our issues, and we go into whatever clinic that might be, and we take our problems in there, and then we get frustrated when they recommend a drug or they recommend a surgery. And I hear patients all the time say things like, that guy just wants to put me on a list of medications. Well, listen, who's responsible for your health? It's not a drug company. It's not a medical doctor. It's not the insurance. Who's responsible for your health? It's you. It's got to be you. You and I have to be responsible for our own health, take it into our own hands. And listen, when it comes to health, and thank God for medicine in a crisis situation, it will absolutely save your life. But when it comes to building health and being responsible for your and I's health, you and I have to take ownership over that. So we need to educate ourselves constantly. We need to be looking at not just the research. Very few people really want to look at the research, but we need to educate ourselves on what it really means to live well. We need to be dialed in nutritionally, understand toxins to limit your exposure to toxins. And I say limit your exposure to toxins because it's impossible to get rid of all exposure. And so understanding toxicity, understanding nutrition, understanding spinal alignment, understanding mindset, and be intentional with your thoughts and taking every thought captive, having a spiritual philosophy when it comes to your walk, when it comes to your spirituality. It's important when it comes to these things. And when you put all these puzzle pieces together, as a max living doctor, we call those 5 essentials because there's 5 essentials to health. When you put all those puzzle pieces together, well then boom, now you have a wellness plan or a vitality plan over time that prevents problems, that can overcome certain dysfunctions that turn into disease. So when you understand it that way and you look at this differently, that's a whole different paradigm shift that must occur, and it causes you to then maybe question some of the technology that is coming out. And so we talked about artificial intelligence in healthcare, and you look at the numbers here. The use of artificial intelligence with healthcare industry is expected to grow between 40% to 60%, up to 6.6 billion in 2021, from 600 million in 2014. So think about this. So that much of a jump from 600 million to 6.6 billion. You tell me, if you don't have a philosophy when it comes to this and understanding of this, it's going to be easy to be talked into or to be persuaded that this is the next best thing. So we talked about AI in healthcare. We talked about AI in healthcare, and I also want to talk about the hot topic of contact tracing. So contact tracing, that is a big topic of conversation right now. The CDC, it recommends contact tracing. You see it popping up on if you have iPhone app, it's going to pop up on your iPhone app with the new update saying that this new contact tracing is necessary and needed. Now, why should you be concerned about contact tracing? Well, here's the reason why. Because again, going back to what happens when you have been exposed to somebody with, let's say, COVID-19 or whatever the next disease is that they deem lethal. What happens when you have been exposed? What happens when you were around someone who may have had it? Well, you might say, well, great, now we can all be connected and we can know. Well, when they exposed 455 people to someone who had COVID-19, they found that zero of them ended up getting COVID-19. Now, why does that matter? Because these are, just because you're exposed doesn't mean you end up getting it. And healthy people sometimes are deemed those who are potential carriers. Asymptomatic carriers is what they talk about. Well, now we know that asymptomatic carriers are not a risk for infection. Asymptomatic carriers are not those who we should be fearing. Those who have taken care of their health, those who have invested into their health care and have been intentional with getting healthy and staying healthy over time, those are not the people that we need to be concerned about. They're not going to be the ones carrying around and spreading disease all over the place. These are the people who have a different understanding of health, and you and I should not be judging those people. Understanding that and having a understanding of the fact that contact tracing is another slippery slope that leads to maybe unnecessary quarantine, maybe unnecessary isolation, splitting you from your family potentially. And just think about that person in a nursing home, that person who really wants to see their kids or grandkids. They're at the end of their life. They would like to see them, and yet because of a certain exposure, they can't. Or think about that family who one person gets exposed in a family of 4, and so there has to be mandatory isolation or mandatory quarantine. The World Health Organization believes and said that it's okay to split up families when it comes to spreading and slowing down the rate of spread of infectious disease. They came out and said that. And so a slippery slope is to be on that radar right there to say, hey, mandatory quarantine because of this person that you were exposed to when you were at Starbucks or when you were at Target. You happen to check out in line at the same time as this person did at Target at that same store. So because of this, there's a quarantine that's now in place. And now you get an alert. All your contacts list gets an alert saying that you've been exposed. That is a slippery slope when it comes to artificial intelligence and also technology in healthcare. And listen, hey, I hear this a lot. Hey, I'm just really not into health. I'm not really not into health. Well, here's the challenge, is that you might not be into health currently, but I'll tell you when you get really into health is when you lose it, is when you lose your health. And this is what I find so often is that health is not a priority until you lose it. And now all of a sudden, it's not health is a priority now. It's really, hey, survival is a priority now. Trying to now overcome or beat this disease, or many times just manage a disease, now becomes the highest of priority. And this is how you get somebody who ends up on several different medications because they did not make health a priority. They supplemented for a symptom, or they gave a medication for a specific symptom, and now all of a sudden they start to feel better again, and so they go on living, and now here they are on 1. And then 1 turns into 2, 2 turns into 3, and this is how it works. And you say, well, I'm just not into health. Well, the challenge is that you have to be. You have to be. You have to have some level of not just understanding of health, but an investment into your health, because that's an investment into you over time. And what is sad is to see that person who ends up not just on a list of medications, but their quality of life goes down over time. And now health becomes a priority because it has to be, because now they're losing their health. And so it's your decision to make health a priority now or later, but it's going to be at some point. And so why not take maybe more of a proactive approach when it comes to your health? Let me give you an example. I had a patient named Mary. She had she had really bad sciatica. And so what is sciatica? It's that nerve pain that goes from your lower back down into your leg. And Mary was gardening and she working in her yard, and all of a sudden she goes down onto her knees because all of a sudden this shooting pain that goes from her back all the way down to her knee. And here she is. She goes to her massage therapist because massage therapy has helped her before. That seemed to actually make it worse. And then she goes into the doctor, and again, they do the same route that I typically, and you can even predict this many times. It's muscle relaxers, pain medications, anti-inflammatories. When that doesn't work, then it's, hey, now try the MRI route. And here's what's very interesting. They went to prescribe her an MRI, and yet the insurance company said they can't get an MRI until she gets physical therapy done. And now here she is frustrated because an insurance company is dictating her care and telling her what care can happen. Well, now she's delayed, and now she can't get the help that she deserves. She ends up hiring a physical therapist, and that seems to not make it worse, but not make it better. So she'd go in and she'd feel a little bit of relief, but it would come right back. And so she gets frustrated and she comes into the clinic and she's, I'm meeting with her, and she's telling me about her story that she's gone through, and she brings her daughter in with her, and her daughter is really just not a fan of natural health or natural health care. She's gone through the medical route. She comes from a medical family, similar to my past, but she's really questioning, hey, can anything natural help her, or should she just go the medical route when it comes to this? But here she is. Mary's been the medical route. She's gone through that, and she doesn't want that. She actually wants to find the cause of her problem and correct that problem. And what's interesting is that we start with what's called a surface EMG test. It's computerized testing developed by NASA, and it reads electricity going down the spine out through the nerves. And remember, the body runs on electricity. The body runs on electricity. Sciatic nerve is a nerve problem, and what ends up happening is that when there's nerve interference or there's nerve damage, this shows up on the scan. So we do the scan and we see it lights up like a Christmas tree in her lower back. So those nerves that come out of the lower back make up the sciatic nerve. I'm talking through with Mary, hey, there seems to be a problem here. Let's take some x-rays. We take x-rays. We find out that the bones in her lower back not only are shifted, but they're not moving well either. So when she goes down and she goes to garden, there's one bone specifically at L5 that shifted completely forward. It was causing stress and pressure on the nerves there, and also was limiting her movement. So her mobility, her ranges of motion was off. When she'd go down to bend forward, what happened is that vertebra would slip even further forward, causing more pressure, and it only took so much for boom, drops down to her knees, and now she's going through the medical merry-go-round. And so the reality is that it's not that difficult. It's really not when it comes to this. You measure, so what we do is we measure the x-rays down to the millimeter to find out exactly how the bones have shifted, where the nerves are being damaged, and ultimately where the problems are coming from. And then we put together a plan of attack to correct that. And then we talk through what are some of the other issues that are occurring there that could potentially be problematic. So that's why we talk about nutrition. That's why we talk about inflammation and toxicity and all these other things that can cause somebody to end up having disc problems, have nerve interference, have issues when it comes to inflammation that leads to things like obesity, or maybe it's leading to things like diabetes or heart problems and things like that. Again, the reason why is because I believe that's what people need. And there's over 400 doctors out there who believe the same and practice the same. And so the reality is that there's a different way. And I realize as I'm talking through this, there's lots of people who might be struggling like Mary was struggling. And thank God she's not struggling anymore. Thank God that she was able to get help and correct the problem and have a now plan of attack for really a lifetime for herself, so she never ends up struggling with the same type of problems again. But the reality is there's a lot of people who don't have that and have never had access to it. And I believe that's the reason why we exist. And that's the reason why I believe I exist.